And now, listen to an interview with the author. Hi, this is Robert Van Kolken. I'm a producer with Macmillan Audio, and I'm here with the author of Being Mortal, Atul Gawande, to ask him a few questions about his book. In Being Mortal, you write about how we deal with aging and our mortality as a society. Are you surprised at all that we pay so little attention to aging and the realities of getting old, given that so many of us are heading into that phase of our lives?
I guess I don't consider it surprising. It's felt to be mostly a bad news story. The experience of aging or facing an illness that we cannot fix is one that causes huge anxiety for understandable reasons. The surprising thing to me is that we in medicine have not been so good at having these conversations with people. Because, we as human beings only experience these things once. Whereas physicians and nurses and others in medicine see a lot of people and accumulate some experience and perspective for being able to talk and understand, to talk through people's experiences. I think what I learned in the process of really writing the book, talking to lots of people, patients, doctors, is that some people in medicine are a lot better than others at handling these conversations. And they have a lot more experience, and they have certain ways that they go about it and have certain ideas in mind. And those ideas, I think, are really fundamentally transformative for how we practice in medicine, but also how all of us as human beings can think about experience and begin to handle what a good life might be as we age and as we face death.
With luck, all of us will get old, and most of us have interacted with someone who is old or someone who has a serious illness. Do you think we willfully ignore what may end up happening to us because it's too hard for us to imagine?
Well, the first part of that is I'm not sure how much we have contact. Our neighborhoods don't have multiple generations in the ways that we used to, and we increasingly sort of segregate off the people who are disabled, elderly. Certainly we, don't see dying often in our lives, or haven't until recently when things have started to change again to bring the dying home. So when it comes to that last fifth of our lives, I'm not sure we are really inside it and see as much what the experience of it is once people shift from independence to dependence. Certainly, though, the children of aging parents, that's the dominant way in which we all have this experience. It's especially the daughters of aging parents who are pulled upon in those ancient ties of family and expectation become a real problem in our two-income earner society and our institutions that feel like prisons for the elderly. I think we feel enormously torn about how to do right by our parents. And so that's where we have the experience, and it feels really awful. and for that reason, we don't look forward to it, and we're certainly terrible about planning for it. I think we like to think it's a very American thing, this optimistic view that we all live forever and we're never going to age, and but what I find and write about is that there's that as countries modernize, this becomes extremely common everywhere. And as our lives get older also, it becomes really interesting that I get to talk about some of the psychological work of research of people like Laura Carstensen, who really shows how, when you start to feel you're within a few years of the possibility that you might might die, that your whole perspective on the world changes. But the reality is that since now the average life expectancy is creeping past 80, we spend the vast majority of our lives never having to contemplate the end in our daily lives at all. You usually don't think about it until you're less than 10 years from the end, unless if you have that process where you get to just get frail and old and die and not have some terrible terminal cancer, like I write about with some of the patients that I describe, or a heart attack out of the blue and those kinds of things. And so in those folks, you have, when we get to live that long, sort of slow progression towards the end, you basically can spend your life without thinking about it all, and that's how we do. And anything more than 20 years from the end, certainly anything more than 10 years from the end, probably more than 20 years, we just don't think about it. Very different a century ago, more than a century ago, where, in the 1800s, life expectancy was in the mid-40s, death was common, and, you thought about your mortality. It was something that had presence in your daily life often, and so that makes a shift in things that's bound not to be there, given what modern life has made possible.
It's interesting to see how people cope with the decision-making that is an inevitable part of aging and of illness. How hard is it for doctors to help patients make end-of-life decisions?
I think it's brutally hard. I'll let people listen to this book, so I won't try to tell a story from it. But I think what I get to explain and describe is that feeling of sitting across a room from somebody who you have to break the bad news that they have a terminal cancer, something I've had to do now many times, and what it feels like to do it badly, what it feels like to do it well, and what the difference is, even in the words you use, the power of the words you use to make that difference. And then, see and feel the process. What I hope is that readers and listeners can see and feel the process of walking alongside these patients, trying to help them along the way, walking alongside my friends, my family members, and that it rings with them with their own experiences about, the moments where things seem to go wrong, where people don't seem to understand each other, and the moments where things really begin to go right and extraordinary things can happen.
If you had one piece of advice to give all of us about how we should think of our impending old age, what would it be?
I think so we understand that that well-being is more than just health and survival and safety in your life. We know that already, but it's okay to insist that that our doctors, our institutions, know that and respect that as well. I think that's the most important thing. And if I saw anything in what happened in the contrast between, some of the patients and family members I describe in the book whose experiences were not so good, and the ones who have a really remarkable experience as they go through aging and dying, that was the fundamental difference. And that there was that recognition, and my God, if the rest of the world didn't recognize it, they found ways to push back and try to make sure they did.
Thanks so much for talking with me.
This is great. Thank you.